Hi everyone, today we are going to talk about the organization of cardiovascular system. First, let's see the structure of heart and the circulatory system. Basically, the heart is divided into four chambers and is often considered to be two pumps in one. The right atrium and right ventricle form the right pump, and the left atrium and left ventricle combine to make the left pump. The circulatory system is a closed loop which circulates blood to all blood body tissues. Blood travels away from the heart in arteries and return to the heart by the way of veins. As the vessels become macroscopic, they form arterioles, which eventually develop into beds of much smaller vessels called capillaries. We, Capillaries are the smallest and most numerous of blood vessels, and all exchanges of oxygen, carbon dioxide, and nutrients occur here. As we mentioned before, the heart is often considered to be two pumps. The right side of the heart pumps blood that is partially depleted of oxygen and contains much carbon dioxide as the result of gas exchanges in the tissues of body. And this blood is delivered from the right heart into lungs through the pulmonary circuit. At lungs, oxygen is loaded into blood and carbon dioxide is released. Then this blood travels to the left side of the heart and is pumped into tissues of body.
Heart muscle is responsible for contracting and forcing blood out of the heart. It contains fibrous pericardium, serous pericardium, and coronal vessels. The space between heart wall and the serous pericardium is the pericardial cavity. Then, the heart wall is composed of three distinct layers: epicardium, or it can be called visceral pericardium, myocardium, and endocardium. Primarily, the outer layer epicardium is serous membrane including blood capillaries, lymph capillaries, and nerve fibers. The function of this layer is to serve as lubricative outer covering. Second, as muscular middle layer, myocardium is the cardiac muscle tissue separated by connective tissues and including blood capillaries, lymph capillaries, and nerve fibers. The function of this is to provide muscular contractions that eject blood from the heart chambers. Last but not least, the inner layer endocardium is the endothelial tissue and a thick subendothelial layer of elastic and collagenous fibers. Its function is to serve as protective inner lining of the chambers and valves.
A recording of electrical change that occur in myocardium during the cardiac cycle is called an electrocardiogram, which is also known as ECG. Analysis of ECG waveforms allow the physician to evaluate the heart's ability to conduct impulses and therefore determine if electrical problem exists. Here is a normal ECG pattern. ECG pattern contains several different deflections or waves during each cardio cycle. The first deflection on the ECG is called P wave and represent the depolarization of the atria. And the second wave, the QRS complex, represents the depolarization of the ventricles and occurs approximately 0.10 seconds following the P wave. The final deflection, the T wave, is the result of ventricular repolarization. Notice that atrial repolarization is usually not visible on the ECG because it occurs at the same time as QRS complex. That is, atrial repolarization is hidden by the QRS complex. So, we can use ECG measurement during an incremental exercise test to diagnose potential heart disease. The most common cause of heart disease is the collection of fatty plaque. inside coronary vessels. An obstruction to a coronary artery, for example, may allow sufficient blood flow at rest but may be inadequate during exercise. Due to increased metabolic demand placed on the heart. Myocardial ischemia, which also means reduced blood flow, may be detected by change in the ST segment of the ECG. Notice the depressed ST segment in the picture on the right when compared to the normal ECG on the left. This ST segment in the picture on the right suggests the physician that ischemic heart disease may be present and additional diagnostic procedure may be warranted.